Namaste, and welcome to our continuing series on homeopathy with our beloved Dr. Pachegaonkar. Today we're going to talk about heart valve problems.
Sure.
It will be very good.
See, heart has four chambers, and blood going to one chamber for its disposal. There is a non-returning valve, like mitral valve, atrial valve. These valves, they ensure that blood flows in the right direction and it doesn't revert back. And generally, these valves get affected in various disorders. The commonest is rheumatic fever, where the bacterial infection in the throat migrates to joints. And these joint pains, especially in young age, like 10 to 25 years, this is the commonest age for rheumatic fever. And then the joints improve, but result into endocarditis in most of the cases, and that leads to impairment of the mitral valve, and that can cause impairment in the valve which it makes it incompetent. So in both the forms, it is stenosed because of the fibrosis. There is mitral stenosis as well as mitral regurgitation, where it becomes incompetent. The blood flow reverts back. It becomes incompetent. So this is a pathogenesis of it. But then, as the heart has to do extra work for pumping it, it's a load on heart muscles. So there is compensation by heart enlargement. The muscles of ventricles get hypertrophied to compensate the blood flow loss. So, but up to certain stage, body can cope with it, and later it starts failing, and that is what the condition is called as congestive cardiac failure.
And how many years go by generally?
See, we have seen in some cases the rheumatism occurs, the joints improve, and after many years, people realize that the person has developed mitral stenosis. But we have seen few cases where both are simultaneous, the joint pains as well as the congestive cardiac failure or the mitral valve involvement. Very interesting phenomenon. In some cases, this mitral valve prolapse, what we call, can go unnoticed. Even at the age of like 30, 35, people have noticed. Because if it is marginal, then the symptoms are not evident. And there are asymptomatic cases there where treatment is not needed. Conventionally, what they do is, if mitral valve stenosis is gross, then they used to repair it. They used to dilate that valve. They used to repair, but now even the valve replacement is done surgically. The artificial valve is inserted, and that also works very well. Depends upon like how much is the extent or the gravity of pathology.
Yes.
But surprisingly, we have cases where we tried homeopathy and conservative treatment. One case is worth mentioning. It was around like 82, 83, 1982, 83. A girl at the age of 14 years of age had rheumatic fever. It was diagnosed. The ASO titer also was strongly positive, showing that it is rheumatic fever. And naturally, the parents were concerned that it shouldn't affect heart, so they wanted to give proactive treatment for that. In conventional medicine, those days they used to give long-acting penicillin for few years, like more than 10 years. The Penidur injections, long-acting, slow-release penicillin, they used to pump for at least 10 years and like fortnightly or every 3 weeks one injection they used to give. But then this girl developed a reaction to it. In test dose itself, she developed reaction, so they couldn't give it. And then said, no, we can't do anything for this. But then, and surprisingly, they had done this 2D echocardiogram, And they realized that she has already developed damage in the wall simultaneously. And at the age of 14,
Simultaneously, yes.
she was sensitive to this penicillin, she was reactive. So they couldn't, so they resorted to homeopathy. So her brother approached me and we started treating her conservatively. And surprisingly, the progression of the valvular damage stopped and she was well maintained. Absolutely, of course, there was ventricular hypertrophy, but it was physiological almost, and she could cope. She graduated herself, she got married, and after that, she conceived, and surprisingly, she had twins. Everyone was surprised that with this condition, the anesthesia person told if we have to go for cesarean, it will be difficult for her to cope up with anesthesia. And she had normal delivery. And every year we used to repeat echocardiogram, and the cardiothoracic surgeon would tell even now the valve is functioning well. So there is no need to intervene. And now her husband is retired superintendent of police. She also, her children are grown up, they are in IT, and she still has same valve, same heart with no problem. So conservatively we could treat her. Means almost like 35, 36 years we are following the case and she's fine.
How do you understand this through homeopathy?
See, in homeopathy, what happens? It is mainly the endocardial layer which transforms into the valve. And that endocarditis, if it is that inflammation, if it is treated properly by the body, homeopathy directly doesn't attack the organisms or the tissues. It educates our body system to undertake proper resolution. So, in inflammation also, always if there is infection, there is a system called as cure, or we can call repair by resolution. By resolution, in the sense, minimal scar tissue is formed. So, repair of the wound or the infected area can take place with resolution. That means the original texture of the tissue is recovered. That happens. This is known in liver and lung parenchymatous tissue, where in always lungs, in general, the lungs will never allow to form fibrosis or the replacement tissue or scars. Always there is repair or cure by resolution. So original texture of the tissue is attained. So same way, our homeopathic medicines, we have medicines like Potentitis digitalis. We have medicines like Crataegus. They can make, if we have medicine like Convallaria. We have medicines like
Convallaria.
Convallaria is a plant that we use.
Very well.
That's the best medicine for compensation of the damaged walls. Laurocirrhosis, that is another plant like we have. So these medicines, they enable the system to undertake the cure of resolution of inflammation so that the original texture of the tissues is attained, and therefore no further damage. The wall doesn't become rigid, so there is no incompetence because that elasticity is maintained. Plus it becomes that stenosis also, because of rigidity the stenosis comes. So even that also is helped. And we have another case like that lady is around 43, 44, and in heart capacity they call it ejection volume, they consider. And
Ejection volume, this is the blood coming,
yes,
going
how
back
much
out.
it can pump, that is ejection.
Yes.
So that efficiency, ejection efficiency, we came to 29. Above 50 we consider normal. Above like 50 to 80% capacity we get. So this lady was having 29 ejection efficiency. And there, of course, 43, 44, then she had hypothyroid and she has hypertension and so many things together. and she approached us, of course, under the supervision of cardiologist. And when we started treating, in follow-up, we have to color Doppler readings. In about 3 months' time, she came to 37% efficiency. And in about another 6 months, now she has 53%, which is perfectly normal. And the cardiothoracic surgeon, he also told now no question of any intervention. Now you are perfectly normal. And those, of course, they were giving some digoxin and all these medicines. They also said now you don't need it. Earlier, they had counseled the family that prognosis is very bad. It won't reverse. Somehow we'll have to maintain her in that.
I would like to ask you about metropolol and what you feel about it.
About?
Metropolol.
That we have not studied yet. Actually, what happens, such cases we have to study under supervision of the concerned experts. So I had opportunity of treating all these mitral stenosis, mitral incompetence cases, whereas left ventricular hypertrophy was the diagnosis. Even congestive cardiac failure cases we could treat. These I personally don't have experience of this.
I would like to ask you about this young boy, I won't mention any names, who had very serious rash breakouts.
Yes.
And eventually it did not stop with homeopathy. And I understand he's now seeing a skin specialist.
It's very tragic in this case. I tell you, initially the child was brought to me for eruptions, and they were like non-specific eruptions with distribution on extremities, like lower limbs and upper limbs. Yeah. And we started treating. Actually, these are all what we call eruptions coming out of some allergic phenomena. It can be viral infection like chicken pox or measles, or even in chikungunya cases we get. So we started.
Could it also be a particular food?
Can't say. That's what. We can't attribute it to anything. But unfortunately, in this case, what happened? The parents got restless. It were like 4 or 5 days and eruptions are not subsiding, and they are progressively increasing in number. But the child did not have any sort of discomfort. No itching, no burning, no fever, nothing. And they got concerned, so they, without my knowledge, they consulted a pediatrician. It's a very senior pediatrician from our area. And she suggested, it being skin disease, you go to dermatologist. And dermatologist also saw that it is some sort of allergic dermatitis, and she gave antihistaminics for 15 days and topical lotion for like again anti-allergic type. And 3 days it was given, and third day the child developed reaction.
I understand he was unconscious.
No, initially he got swelling on the face and the preputial skin in the penis. He got. And then they consulted the dermatologist again, and dermatologist said, I'm out of station. So then she told, okay, go for these tests. And she suggested that some hemogram and kidney function test. Kidney functions were fine. So she said, you continue. And next day the child became unconscious. Maybe low BP, bloated, couldn't recognize. So under emergency, they took it to general hospital under pediatric care. And any allergic phenomena with this crisis, they started giving steroids. Child was in ICU, and they gave 3 days of steroids treatment, and still the eruptions are same. And now 99% it is the suppression of these eruptions to which the child has reacted. So unless steroids are like immunosuppression, And when steroids are being given, homeopathy will not be working, because it's homeopathy works through own immunity. And when immunosuppression is being given as a palliative, homeopathy will not play its proper role. So now the child is under pediatrician's care. Child has recovered from that shock. Fine, child okay, but the eruptions are same. Now, the moment you withdraw the immunosuppression, fortunately, see, we always consider that these eruptive fevers, it's like body is venting it out. In chicken pox or measles, if the eruptions don't erupt out, it's most dangerous. It's most dangerous. Even in herpes zoster, we have seen. See, these eruption, it's like, body tries to vent it out, or we can call it quarantining the infection for the time being. It's an outdoor expression. So you can't suppress locally. There's no logic in suppressing and giving anti-allergic in chickenpox. If it is diagnosed, they never give anti-allergic to that. But here it was given, so it is really a typical case of undue suppression and playing with the immunity of the child. Unfortunately, the child has to suffer. But now still last more than like 15 days now, the steroids and anti-allergics are being given. But because those...
Are they not damaging to the child?
No, but they say it is a life-saving measure. So little damages we will bear with it. So now, and under such circumstances, homeopathy, we can't take it up. And what happens, once science is established, like you have a team of 100 doctors and all, their decision making is different. No one will believe with a homeopath sitting with OPD, even if he has 43, 44 years of experience.
Understand.
It's like this.
What will happen when the steroids are discontinued?
See, if the child is lucky, would get eruptions on the skin, and then they will be allowed to be resolved without developing anything. If it is suppressed, then again there would be a problem. So somehow the child's system has to resolve the pathology. These immunosuppressants won't be able to cure it properly. Actually, sometimes they say that the system is under crisis, and therefore as a temporary solution they give immunosuppression, and slowly they taper it off. That is what they are doing now. But again, they are suspecting it should be some autoimmune phenomena or some malignancy or something like a cancer or something. So even parents are terrified now. When last week the pediatrician mentioned that we have to go for further tests with full thickness biopsy, skin biopsy or something. Maybe it is some autoimmune phenomena, or maybe it is some cancer or something.
I see.
So,
but suppression is never the way.
It can be. See, nowhere it is justified that the child was given antihistaminics. What antihistaminics are going? You can diagnose what allergy is and all. You can manage it. But just blindly, the dermatologist prescribed 15 days of antihistaminics. And very third day, the child developed. We have similar case in ashram school. The child got similar eruptions. And child was not brought to me at that stage. With these eruptions, child was taken to our doctor from dispensary, and they gave anti-allergic. And very next day, the child developed similar reaction. And then they brought the child to me. Okay, this is the reaction and all, but they had given only for 8 hours antihistaminics. So I said, but on daily basis we'll follow it. And daily the child was being brought to me, and we monitored, and it subsided. Typically, like this child, the boy had swelling on the penis, puffiness on the penis, face, it was bloated. And very third day it started resolving, and in 5 days a child is perfectly normal, coming to school now. But the best day was, child's elder sister is inmate in the boarding, or ashram school boarding. And that caretaker, the warden of that girl, she insisted that you come to homeopathy, don't take this. And she brought the child to us. And the child has improved in 5 days. Of course, daily we were monitoring. But similar case.
These severe eruptions on the face. I know a young girl, she must be in perhaps her late 20s, and a beautiful girl, and the face is just pocked with, I don't know how you can call it, because it looks like
Pimples or acne pimples are there.
acne pimples and blotches, swellings.
See, that's what we say. These are expressions on the skin, but it's not a local disorder. It's something internal. It can be a hormonal change, it can be like deficiency, it can be vitamin C deficiency. All these things contribute to it. It can be a hormonal changes, it can be like ovaries malfunctioning. So there are so many factors involved in formation of this. So local treatment, we can say management can be done. Local management in the sense like simple thing we do, like if there is a secondary infection, we should take care that there is no secondary infection. Secondly, we just advise girls not to break it open prematurely, because if they see in any eruption, if the pus has to go out, body forms a capsule around that debris, and once the everything is protected and capsule is formed, then body arranges drainage. Prematurely, if you open where the capsule formation is raw, we call maturing of the abscess. So if it is not ready, then the healing takes time. It's a delayed healing. Not only that, they develop scars, and those scars go deep. So otherwise, facial skin is so delicate that if eruption is there and pus formation is there, and if it drained properly with proper encapsulation being done before opening, the healing will be without developing any scar. No disfigurement will be there. But people, they are a bit restless, impatient type. They break it open.
Yeah. And of course, it's a concern of looks too, how a person looks. Yes. Wonderful session, sir. Thank you so much.